Welcome to Mansik Shakti Foundation and its course Mind Sciences for Students' Well-being. We are talking about navigating challenges of students' life, and in that we determine that the first and the foremost challenge that our students face is that of mental health issues. If we have to prevent and save them from developing mental health problems, mental health challenges, stresses, psychiatric disorders, disabilities, etc., then not only we have to be able to identify these disorders, but we have to be competent to know the risk for mental health condition. So that's the topic today that we would like to discuss, that what are the risks? Are there risk factors? Are there individuals who are at risk? Are there any other determinants? Any situation which makes them more vulnerable for developing a mental health condition? Can we identify these students and can we provide some kind of surveillance and support, whether academic or mental health support, to empower them and teach them skills of life to develop their mental strength? Risk to mental health, a further critical way in which the risks to mental health interact over age and gender and time. So these risk factors which are the risks for mental disorder is specific to a particular age. So it is different in children, a different set of risks for adolescents and for adulthood. A life course approach is used here since it shows how risk exposes us in formative stages in life, when brain is developing and when brain is fully developed. In both conditions, the risks affect individuals differently. An alternative approach for understanding the perspective could be taken, and that is a socioeconomic status, income status, and its influence on age groups. It is also the case that not all risk factors in a particular age group are equally potential. These are very specific to every person and their prevailing situation. For example, somebody may be living in poverty at the age between 5 years to 15 years, and another person may slump into poverty from age 20 to 30. The mental health consequences and mental health condition, their ability to protect their mental well-being will be very different. The person who is exposed to risk in a younger age is far more vulnerable because of brain development conditions, because it is the brain which decides the signals for developing or not developing a mental health condition. It is the brain chemistry which determines, and the brain is developing during childhood, and therefore the risk factors are far more lethal in early ages of life. In fact, it begins from preconception and prenatal period. That is the time when the life begins and when you are in the womb of your mom. An individual's mental health can be influenced by events or circumstances occurring before their birth or even their conception. Pregnancies that are unwanted or take place during adolescence, for instance, can raise the chance for risky health behavior in pregnancy or mental health problems in childhood. Likewise, poor adaptation to pregnancy can be considered a potential risk to the child's mental health as well as physical health. It is already well established that malnutrition, low birth weight, and certain micronutrient deficiencies such as iodine deficiency significantly heightens the risks to brain development, as do risky health behavior in pregnancy, especially the use of tobacco, alcohol, or drugs. While you see the same issue during infancy and early childhood, that is up to the age of 2 years, there is a strong body of research evidence to show that importance of attachment by neonates to their mother or another primary caregiver for subsequent social and emotional development. Separation from primary caregiver due to examples of prenatal absence, due to examples when parents are either absent or mother has become very ill, has led to sense of insecurity, leads to anxiety and stress. Postnatal depression among new mothers can likewise contribute to suboptimal attachment. So if the mother-child bond has not developed well, it's a huge pathology. The attachment, security, safety, emotions like that do not grow and people remain vulnerable. Parents who have difficulties in bonding, have limited skills or exhibit negative attitude, place their children at increased risk of exposure to stress and behavioral problem. Other important risks to physical and cognitive development in infancy and early childhood include maltreatment and neglect by parents or other caregivers or family members, malnutrition or infection or parasitic diseases, many subhuman conditions, whether it is social, economic, health criteria, nutrition, leisure time activity, love and affection, emotional bonding, all these factors influence constitution of defense mechanism that everybody develops against mental health conditions. In children, childhood years are vital for developing life skills. It is the time when their emotion is developing, intellect is developing, cognitive development is taking place, and they are learning the skills of academia. They are learning to learn and new skills are being acquired. So their brain is going through huge plastic changes, and negative experiences within the home or at school due to family conflict or playground bullying or, for instance, have a damaging effect on development of these core cognitive and emotional skills. Supportive parenting, a secure home life, and a positive learning environment in school are key protective factors in building and protecting mental well-being, or a capital at this stage of life. Risk to mental health includes family violence, conflict, negative life event, low sense of connection to school or other learning environment. At their worst, exposure to such risk as a result of persistent beating, severe bullying, parental loss or abuse can cause a level of trauma that has an indelible effect over the rest of person's life. Socioeconomic conditions in which children grow up can also have a telling impact. Poor housing or living condition, for example, may be seen by children as shameful or degrading, may reduce opportunities for productive learning or social interaction or developing meaningful social relationship. It may increase their exposure to disease, injury, and changes in behavior. Children with parents who have mental illness or substance use disorder like alcoholism are placed at a higher risk of experiencing family discord or psychiatric problem. The intergenerational transfer of mental disorder is the result of interaction between genetic, biological, psychological, social risk factors occurring at as early as pregnancy and infancy. Adolescence, at the same time, also constitute a critical formative stage in life. Marking it does the passage from childhood to adulthood. Adolescence is also the period when mental disorder is more likely to develop or become apparent. The first symptom of many severe mental disorders which begin in adulthood are seen in the age of 14 to 17 years. Adverse experiences, conditions, or environment that affect mental well-being of younger children apply equally to adolescents. In addition, there are a number of other significant risks that have particular pertinence to this life stage. Things like tobacco, alcohol, drug abuse are all very toxic substances which are detrimental for brain maturation and brain development, and therefore become a risk factor or may directly affect neuronal health and may lead to psychiatric disorders. Adolescents exposed to family unrest or exhibiting behavioral problems in childhood are more likely to engage in psychoactive substance use. Substance use disorders, particularly hazardous and harmful for adolescents because the brain and body both are still in developing stage. They are not equipped to handle toxins either emotionally or not in a state of right frame to understand the consequences, which are short-term or long-term consequences in a life course. Adolescents are also susceptible to peer pressure, increasingly media influence that may encourage substance use. In addition to these risks to health, substance use in adolescence is linked to lower educational outcomes, more risky sexual behavior, and heightened violence. When we see the risk factors in adulthood, we find that individuals who have a secure and supportive period of adolescence and childhood behind them are emotionally more mature and who are able to exercise emotional control, emotional regulation, and emotional optimization and societal aptitude, are better equipped to deal with set of choices and challenges that they face in their life. One of the most critical choices to be made and a key determinant of an individual's well-being concerns the work-life balance. In economic terms, the allocation of time between production and consumption. Stress and anxiety are frequent outcome of persons spending too much time working, caring for others, or operating in a difficult, insecure work environment, as it is for those able to and willing to work but unable to do so because of adverse socio-economic situations. Unemployment in particular is a well-established risk factor. Unemployment is associated with greater health care use and higher death rates. Association also works in opposite direction, that is, mental ill health is significant predictor of unemployment, and it is in its way debt and financial liabilities leads to impoverishment. Outside the workplace, a vital source of well-being is participation in life and activities of local community, engaging with others, trying to understand each other, human beings, and social conditions. Exclusion from such activities due to lack of access to neighborhood, violence, crime, breakdown of civic trust, respect are some of the other conditions which are worth considering as mental health risk factors. Absence of respite or care. A further core dimension of individuals' welfare is health itself, the physical health. Those who are physically in a poor condition are repeatedly exposed to infection or long-term physical disorder, whether it is gastrointestinal or musculoskeletal, or it is headache or bronchial asthma or heart condition or diabetes. They all are vulnerable to develop a mental health condition. As much as 40 to 50% people suffering from chronic physical condition develop number of psychiatric disorders. Ill health or disability therefore constitute another important risk factor for psychological well-being, in general depression. Individuals with chronic disease and disability particularly includes the conditions like HIV and AIDS, infections like tuberculosis, leprosy, and many others. While some diseases processes directly affect the brain, like cerebral malaria and HIV and AIDS, and then they expose and make the brain condition directly vulnerable to develop a mental health condition. And the other group, it is the psychological reaction which becomes more predominant. Similarly, in elderlies, older age is a single most important predictor for cognitive decline or dementia. When you start forgetting things. Older adults are also at a particular risk for developing social isolation, poor health conditions, economic deprivation, less social support, being away from children, having emotional trauma, and unfortunately many of them, when they lose their partners and they remain single, their problems complicate, and therefore suicide rate is very high in people who are 65 plus. Feeling of isolation can also come about due to loss either of their partners or many often from their social contacts or connectivity. Social and family isolation is also seen when bereavement sets in because of death in the family. Bereavement is a predictor for major depression. Other risk factors include, addition to this, are present when you find that there are not age related. So there are certain risk factors which are common for all ages. For example, loss, economic loss, loss of loved one in the family, migration, physical disorder, and something like that. Since even these basic socio-demographic characteristics of individuals are framed by social norms, customs and personal gender and ethnic reality, the social conditions matter the most. It is the person sitting next to you in your house or in your community who makes you feel secure and comfortable. And therefore, a group living or community feeling or sensibility in reaching out or approaching others, developing human connections, these abilities are highly protective. Factors like racism, discrimination, humiliation, social isolation, social exclusion, intimidation are hugely important psychological stressful conditions which are directly related to higher incidence of mental health condition. Persons exposed to violence, armed conflict and natural disaster are also highly vulnerable. These adverse conditions prevail in population in many rich as well as in poor countries. There is no difference as far as geographical location is concerned. There are the emotional factors which are at a risk factor are universal, whether it is low income country or a higher income country. Both poor and rich suffer alike if the risk factors are predominant. But what matters is developing the protective network. There are factors which are protective, which prevent development of mental health conditions. We'll continue to talk.